Salmonellosis. This video is presented by Janet Sosa, Jennifer Rossi, and Jessica Padilla. Salmonellosis. What is it? Salmonella is a bacteria that causes one of the most common enteric, which means intestinal infections in the United States. In 1985, a veterinarian named Daniel Salmon discovered a new bacteria. It was later named in his honor. This bacteria was a gram-negative, facultative, and enterobacteria, which thrive within the intestines of humans and other animals. A simple way to look at the two different ways that this disease can be transmitted is typhoidal and non-typhoidal. Typhoidal transmission is entirely human transmission. Non-typhoidal is mainly transmitted between animal products to humans. There is approximately 2,000 serotypes that cause diseases in humans. This means that there's more than 2,000 different types. They are categorized by the differences in the antigens. Even with all this information, death from salmonellosis is very low, less than 1%. It is estimated that 1.4 million people are infected each year. Salmonella bacteria can be found in food products such as raw poultry, eggs, beef, and sometimes unwashed fruit. Salmonella is found in the intestinal tracts of animals. If food is not cooked properly, then the bacteria can be ingested and cause illness. Food prepared on surfaces that were previously in contact with raw meat or meat products can become contaminated with that same bacteria. This is called cross-contamination. In addition, food that is grown in contaminated soil, this includes any vegetables or fruits, are all possible carriers of this bacteria. It's important that we thoroughly wash or cook these ready-to-eat vegetables. One of the last ways that this bacteria can be spread is through reptiles. The transmission rate of reptiles can be as high as 90%. Because of that fact, the FDA has strict regulations on the sales of reptiles.
Signs and symptoms. Salmonellosis infection usually lasts from 4 to 7 days. Most people recover without treatment. When the person is hospitalized, it's due to the spread of infection from the intestine to the bloodstream. Elderly and infants are at an increased risk of developing severe complications. This is because they are likely to have a compromised immune system. Salmonella bacteria can be detected in stool, blood, urine, or on rare occasions in tissues. Samples are collected and grown in nutrient broth or on agar plates. They are incubated for 2 to 3 days. After that time, a trained microbiologist can identify the presence of the bacteria. Infections usually end in 3 to 7 days. Many times they require no treatment. Persons with severe diarrhea may require rehydration therapy. For less severe cases, drinking electrolytes is enough. In severe cases, hospital-administered intravenous fluids are required. Antimicrobial therapy or treatment with antibiotics is not the first line of defense. Antibiotics are usually only recommended for persons with high susceptibility. In situations in which antibiotics are needed, antibiotics use is for 4 weeks and is generally recommended for Salmonella typhi infections. The specific antibiotic chosen depends on the susceptibility of the patient.
Good hygiene is the best way to prevent salmonellosis. Some examples include frequent hand washing, cooking meat to its proper cooking temperatures, and avoid the consumption of raw or undercooked meats. Furthermore, limiting the consumption of unpasteurized dairy products. If preparing food, make sure that you are working on a clean cooking surface area. If you own a reptile or are in contact with one, make sure not to allow reptiles or amphibians roam freely throughout the house or in areas where food or drink is prepared, served, or stored. These areas include kitchens, pantries, or outdoor patios. Do not place reptiles or amphibians in bathtub, kiddie pools used by children. This concludes our presentation on salmonellosis. Thank you for listening.